Greetings from Dr. Smith Direct Care. Today we're going to talk about springtime allergies. Uh, this is certainly near the peak pollen season in Arkansas and in much of the rest of this part of the country. And I would dare say that the majority of people have at least some kind of symptom during the pollen season, either just irritation from the thickness of the pollen in the air or from allergy itself. So let's first talk about the difference between these two things. Going out in the spring when the breeze is blowing and the pollen is like rain, is kind of like inhaling dust and can cause gritty sensation in the eyes with almost like a foreign body reaction in the eyes. And certainly it can cause irritation in the throat and lungs. And if you're out running, walking, or jogging, you find yourself coughing more and having to clear your throat because of just the irritation of the pollen in the air itself. And this is not actually allergy. But you might find yourself wondering if you have allergies. Well, you probably don't. It's probably just irritation if you don't have a lot of tearing and sneezing and nasal congestion. So the majority of people will have that, but a substantial percentage of the people will also have actual allergic symptoms. And these are due to the formation of antibodies from the tree pollen that causes this antibody, IgE antibody, to react with the histamine releasing cells of the body to release histamine that has an effect on the nasal passages in the eyes and the respiratory passages that causes tearing, nasal congestion, scratchiness in the throat, sometimes coughing, and sometimes asthma attacks, particularly if there is a history of asthma previously. So this is one of the most common things we see in the office during the springtime is patients presenting wanting to know what else they can do to control their springtime allergies. So the basic approach that I take is to have the patient start on a daily dose of an antihistamine. The one I recommend is usually loratadine, which is in a dose of 10 milligrams a day. This is also called Claritin and is now available over the counter, so it doesn't require a prescription. This will control symptoms in a substantial percentage of patients. But if there is continuing sneezing and nasal congestion, you can certainly add a nasal steroid spray. I recommend Flonase, which it can also be purchased over the counter, and use 2 sprays in each nostril once a day. And again, this will control, in conjunction with the loratadine, the majority of patients' symptoms. But if not, you can go with some additional choices that do require a physician's prescription or intervention. The first one I'll mention is Singulair, which is a medication that can be prescribed to take once a day, 10 milligrams a day, and this causes an inhibition of these histamine-producing cells from releasing the histamine in the cells, so it helps control the symptoms in that way. And then finally, if the above are not sufficient, the physician might elect to add a short course of oral steroids such as prednisone, maybe for 7 to 10 days, or possibly to give an injection of steroids such as Depomedrol, which actually has about a 2-week duration. And then finally, if you have severe or ongoing symptoms and feel the need, you can request a referral to an allergist and consider undergoing allergy shots, which would involve testing for pollen allergies, identifying the culprits, and then formulating a type of injection which can be given to reduce symptoms over time. So that's a summary of my approach to springtime allergies. Good luck to you.